Welcome back. A crisis is brewing. New health facilities like the Anglo Gold Ashanti Hospital in Carletonville have been left underutilised or not used at all, despite Gauteng battling a third wave. Khumalo is tracking that story now and joins us for this conversation. Kai, always a pleasure speaking to you. I mean, it's a bizarre story, isn't it? There was this big celebration when the hospital was handed over to Gauteng government, and now it appears as though it's not being used at all. Surely the public must be thinking, how can this possibly be, especially in light of how people are crying for hospital beds?
Well, that's right, so Faith, especially when you look at the context of the West Rand. Already in that part of Gauteng, the hospitals are really getting full. So we got an opportunity really to speak to some South Africans who are showing a great deal of disappointment, especially because this was quite a very noble initiative from the side of Anglo Gold Ashanti. You know, you go back to May when Gauteng Premier and many other MECs were there inspecting the facility, boasting state-of-the-art array of features. You know, they do have a number of facilities, including 181 ICU beds, a radiology facility, among other things. So, but, you know, just fast forward to the third wave now that we are facing. That facility remains not used, no capacity and no staff. So we spoke to the Shadow Minister, or in fact MEC of Health here in Gauteng. This is what Mr. Bloom had to say.
Well, I think it's a huge disappointment. It was opened with much fanfare, but one of our DA councils in the area went to visit there, and she says that there's no staff, there's nothing. It's not going to see a single COVID-19 patient, and which is an absolute tragedy because hospitals in the West Rand are already very overcrowded, and there's 400 new beds at the Chris Hani Baragwanath Hospital that they can't use because they don't have staff. Meanwhile, they've spent 500 million rand on a hospital that can't be used because it's far away from major population centres, and it doesn't even have the staff or equipment. So it's tragic, it's really tragic, and people are dying, people are suffering, and this money was wasted when it could have been spent far better in hospital beds where they could have been used.
Well, Kai, then exactly what has government been saying?
Well, I'm afraid, Faith, we've spent a bulk of today trying to get a reaction from the MEC, the spokesperson, but I'm afraid they haven't been forthcoming with information in terms of the update. But what we do know is that they do maintain that the system is resilient as much as we're seeing the spikes, but also they're ramping up the vaccination campaign in the country's economic hub. But this is quite disappointing, especially because, you know, this is a very good public-private partnership, as it were, with this facility presented to government, with it remaining unoperating. It's really concerning, especially because, you know, we're seeing the spikes in terms of the cases in the province. But also, a very important information in this regard, Faith, is that the SIU is seized with investigation. 500 million rand was used to refurbish this facility because it was owned by the mining companies, and then it was handed over to government for government to make sure that it's well capacitated. So we'll just keep a close eye to look at those investigations by the law enforcement agencies.
Well, Khumalo, the plot certainly does thicken. We'll leave it there for now. Thank you very much for that, Khumalo, giving us the latest there on hospitals being underutilised, even though handed over to the government in light of the COVID-19 third wave. One wonders how can that possibly be. We're going to